Great. So Optum Ventures, we were founded in 2017, and it was kind of the recognition of leaders within United Health Group that they had done a few different things in the past where, they had been an LP in other venture funds and they had these internal accelerators and different things like that. And it was honestly really difficult to kind of get the right strategic alignment inside the organization and an organization that big. For innovation and working with the broader innovation ecosystem while also allowing companies, that are growing really quickly and obviously much more quickly than the broader organization is to work with the rest of the market and kind of maintain that startup feel. And so we were founded in 2017 to sit outside of the organization, but directly aligned with. So United serves as our sole LP, but we're not United employees. And I think that allows us to be incentivized by our portfolio and our companies and working with the broader healthcare market, but obviously want them to be able to work with United and Optum in unique ways over time. And so with that, we've invested in about 60 companies to date. And that kind of ranges the gamut of like traditional healthcare services and care delivery and telehealth and virtual care, all the way through to true enterprise software and tech solutions that are serving healthcare businesses in unique ways. And so, with that, I think that we've been pretty flexible. I would say the first few years, we looked more like a traditional Series A, Series B investor. Say over the last couple of years, as the markets, just changed and more investors have come in, honestly. We've been pretty flexible in terms of going much earlier stage into the seed stages through to like growth stages and really doubling down on bigger checks in our portfolio. And so with that, I think, just kind of look to the broader healthcare landscape. And I think majority of our companies at this point are working with United and Optum in some way, but they're also working with all the other payers and providers. And I think we are really proud of that, don't want them to be solely focused on United in that way. But I would say, for myself, I sit on the investment team at Optum Ventures. So there's about 10 of us here in the US, and then another 5 or so in London doing all ex-US investing. And then we have a partnerships team as well. And kind of their sole function is exactly that, kind of helping the portfolio look to United and different opportunities within the org, as well as kind of in the reverse, talking to different stakeholders across United and Optum and identifying what their needs are, even if it isn't in the portfolio today or specific companies, just helps a little bit from a thesis development and seeing where we should be looking around the corner, 12, 18 months from now in some of those pieces. I joined the team coming up on 3 years ago now. And prior to that was in healthcare consulting, mostly working with health systems and medical groups.
So you mentioned Optum, United, and then also providers. I would say we're more on a provider side. What are you doing? Are you helping roll them up into a value-based care model?
Not necessarily rolling up. So as Optum Ventures, we are doing only minority investments, and anything like on the provider side within Optum is, sitting on the corp dev side within the organization. Optum, of course, is, one of the largest employer of physicians in the US. And so we work with the stakeholders on the Optum side that are doing that pretty consistently. And they have a lot of different care delivery organizations within Optum Health and Optum Care. And so we work closely with them for how they can, work with our companies, whether it's from a revenue cycle perspective or whether they want to be offloading risk to some of our specialty care platforms or different pieces like that. But from an investment perspective, we're not like directly buying physician groups or anything like that.
Yeah, I'm just looking more for the model. Are your providers primarily fee for service or primarily value-based care?
Do you mean on the Optum side or the Optum Ventures portfolio?
On the Optum side, where you said you're the largest.
Yeah. So I would say it's a broad spectrum, right? It's extremely geographically varied in the sense of like, for example, the providers on the West Coast and Optum Care West Coast in California and the Pacific Northwest are pretty much in exclusively capitated arrangements and full risk, whereas maybe in the Southeast in Georgia or Florida, it's a little bit more heavy fee for service and, probably not looking as much risk. And then, somewhere like a Texas or a Tennessee is probably a little bit of both, and similar to here in the Northeast where we are in Boston. So it's extremely varied. I think like the rest of the physician ecosystem, some of the larger groups have been a little bit more forward thinking in that. And I would say overall, they are looking to move a lot of the risk from the MA book over to the Optum Care side and seeing how they can align the physicians in that way. So a lot of them do hold risk, but the quick answer is it varies a ton, and it's mostly geographically.
And why would you say it's forward looking? Because is that just based on CMS's agenda to promote the value-based care model, the risk share model, or do you personally like that model? I'm just trying to see if there's alignment here.
Yeah, I think all of the above. I mean, we invest in a lot of companies that are looking at value-based care, and definitely think that it's aligning incentives across the organizations, whether it's payers or providers or the members, and the quality outcomes and safety and quality that you want to be looking for. So I think the answer is all of the above, but not exactly sure what you mean by that. But yes, we invest across the value-based care ecosystem, whether it's the technology enabling it, whether it's the physicians providing it, or all of the above.
Mm-hmm. Mm-hmm. Yeah, I just don't think we're aligned, because I did, if you'd done your research, you'd know that I completely disagree with the value-based care model, and I think it's setting up our healthcare system for some very poor outcomes very shortly. So we're actually contrarian, and there's some aspects of value-based care that I like, but you're completely taking a full lever of control away from physicians. All you can do is control cost, and by controlling cost, you're essentially, for lack of a better term right now, you are coordinating care and allocating it in different ways. We can say it's a fair allocation, or sometimes maybe not or an unfair allocation, and you're doing that across our riskiest population, which just happens to be our parents, primarily Medicare beneficiaries. So I completely disagree with that model. So there's no alignment here.
Okay. Yeah, I mean, I'd love to hear more about how you're approaching it and what you think
Yeah,
could be done differently.
so we're decreasing costs for providers by essentially helping them replace revenue cycle management companies by automating the revenue cycle management at a fixed fee rather than a percent of collections, and then finding dollars across the organization through like actual value enrichment and actual raising the quality of the patient experience, whether that's digital experiences, kind of implementing next generation technology inside of the practice that helps them streamline basically patient communications, patient onboarding, things like that. But our biggest value add is automating the revenue cycle in such a way where you really don't need a revenue cycle management company. You don't need to be throwing away 5 to 10% of your cash collections, and then giving them the actual accrual-based reporting on an automated basis so that they're actually managing, and we're educating our physicians to manage their business based on an accrual accounting system and not 2-3 months in the past.
I think all of that is definitely heading in the right direction, and really great. And I'm curious though, if you think that can exist in a world where incentives are aligned on both sides. It sounds like a lot of that is on the administrative side, and helping take costs and time, and saving time and costs for providers. And so if that can exist in a world where they're also incentivized on the patient care side.
Yeah, they're incentivized on the patient care side, but the good thing about the fee-for-service model is they're incentivized to provide care. The issue with the value-based care, especially a full risk model, is you're incentivized not to provide care, because that's how you cut costs, is not to provide care. And I've seen it happen empirically, and there's a lot of science, there's a lot of studies going on that are showing the true cost of value-based care, which is essentially people aren't getting the care that they need. So we're just not aligned on that model.
Okay. Well, sorry to hear it, and glad that we could connect. But it was great talking to you then.
Yeah. If I can change your mind or persuade you, which is probably not going to happen, feel free to get back in touch. But
Okay. Yeah, I mean, I'm always open to new solutions and seeing how we could work together. But sounds good.
Awesome. I appreciate your time.
Thank you.